Hey, welcome back to Not So Complicated, and today we'll be learning about another nightmare of med school, that is brachial plexus, its clinical anatomy, and we'll also learn to draw how to draw this plexus and never forget it. Alright, so what we'll be studying today is the formation of brachial plexus, that is roots, trunks, divisions, cords, and branches, and also clinical anatomy like Ops palsy or Klumpke's palsy. And this right here is the brachial plexus, and so how to draw this. So grab a page, that is blank page or white page if you have right there, and a pen. Now this is a blank page. All right, so what you have to do is write roots, trunks, divisions, cords, and branches in the uppermost row like this. All right, so then you have to draw these dotted lines right here, dividing these five different things, that is roots, trunks, divisions, cords, and branches. You have to remember this in order, that is RTDCV. All right, so there are five roots of brachial plexus: C5, C6, C7, C8, and T1. These are the five roots. And then after these five vertebrae, what happens is there are five ventral rami or anterior rami that come. All right, so that these rami will make the further structures that forms brachial plexus in overall. So what happens is sometimes there will be involvement of C4, and if there is involvement of C4, then that is called prefixed plexus, and if there is involvement of T2, that is called post-fixed plexus. All right, so what you have to do now is that you have to draw a root from C5 like this and C6 like this, and this have a common point in there. All right, so and then C7 you have to draw a straight line, and you have to repeat like just like C5 and C6 for C8 and T1 like this is very simple. All right, so now these are the roots. So what happens is there is a branch arising from C5 nerve, and that is called dorsal scapular nerve. And when the fibers from C5 and C6 and C7 get combined to form another branch, that is long thoracic nerve. All right, so now we'll be talking about the trunks. There are three trunks. So this is superior trunk, and this is middle trunk, and this is inferior trunk. All right, follow me just like what I have done right here. All right, so now what happens is there are branches of superior trunk. So the first branch is suprascapular nerve, and then the second branch is subclavian nerve. All right, so let's talk about the divisions. So each trunk has two divisions. All right, so in the superior trunk there is this division called anterior superior division, and then there is this division called posterior superior division. And then in middle trunk there are two different branches again, divisions again. So the first division is anterior middle, and then second division is posterior middle. So the naming of these divisions are just like that, right? So in superior trunk there is anterior superior division, and in another one is posterior superior. All right, so in middle trunk there is anterior middle and then posterior middle. So it follows the name of the trunk. All right, so what happens is that there is another two divisions of inferior trunk. This is posterior inferior trunk, and then this is anterior inferior trunk, right? So these are the divisions. We just follow me. So there is crisscross in the divisions of superior trunk and middle trunk, and the inferior trunk's divisions are independent to the divisions of superior trunk and middle trunk, right? So there will be the formation of cords. These cords are a little bit thicker than the trunks and divisions, and also branches. These cords are thicker, so it forms the lateral cord, and the second one forms the posterior cord, and the third one forms the medial cord. So these different cords have different branches. So the lateral cord has three different branches. The first branch is lateral pectoral, so even the cord's name is lateral cord. All right, so there are two branches starting from lateral, the name. So the first one is lateral pectoral nerve, and the second one is musculocutaneous nerve, and the third one is the lateral branch of median nerve. So three nerves of lateral cord. One of them is lateral pectoral and lateral branch of median nerve, and another is musculocutaneous nerve. All right, so there are different branches of posterior cords like this. The first branch is upper subscapular, and then the second is thoracodorsal, and then third is lower subscapular, and axillary nerve, and also the radial nerve. So what is the mnemonics for this posterior cords branches is that ultra, ULTRA, that is ultra. So upper subscapular, lower subscapular, T for thoracodorsal, R for radial, and A for axillary. So this is the mnemonics for the branches of posterior cord. And then there are different branches of the medial cord. There is also mnemonics for that, that is 4M, U. 4M and U. There are 4M, alright? So the first one is medial brachial, and then medial antebrachial, and then medial pectoral. The other branch is ulnar nerve, and the other branch is the medial branch of median nerve. So the lateral branch of median nerve, which is the branch of lateral cord, will be combined with the medial branch of median nerve, which is a branch of medial cord, to form median nerve. So this is how brachial plexus is completed. All right, so this is how you draw the brachial plexus. So if you have any confusions, so you can comment it down. Now talking about the clinical anatomy, first let's talk about the Erb's palsy. All right, so this is the point. This point right here is called Erb's point, where there are branches of like anterior division, posterior division, and there are suprascapular nerve and nerve to subclavius. So this is the point, is called Erb's point, and when this point is injured, then Erb's palsy happens. So this is the manifestation of Erb's palsy right here. So the causes for this palsy is like if there is forceful delivery of the child, all right? So if there is forceps delivery, that will lead to Erb's palsy. So the symptoms is that the arm is adducted and medially rotated, and the forearm is extended and pronated. All right, so the muscles paralyzed are supraspinatus, deltoid, infraspinatus, teres minor, biceps brachii, brachialis, brachioradialis, and supinator muscles. These are the muscles that are paralyzed in Erb's palsy. So in Klumpke's palsy, so manifestations is like this, that is a claw hand. All right, so there will be wasting of forearm muscles also. So the causes are similar to the Erb's palsy, and the site of lesion of this Klumpke's palsy is lower trunk of brachial plexus, that is C8 to T1, and the hand is in the position like hyperextension at metacarpophalangeal joints and flexion at interphalangeal joints. You can check it out in the figure right here. All right, so the intrinsic muscles of hands are also paralyzed, and there will be sensory loss in the skin also. So that is all about the brachial plexus. Subscribe for more clinical pulse like this, and thank you for staying with me. Thank you.